go over CNS drugs real quick. So grab that big packet I gave you, and then also the PowerPoint that goes with Chapter 9. I think I gave you both of those. Yes. Let's go over the PowerPoint in Chapter 9 first.
And this is Chapter 9.
Mm-hmm. Okay, let's look at the CNS drugs first.
These two things right here?
Yeah. We're going to look at the PowerPoint first, the pharmacy technician PowerPoint. Talk too long on that thing. Oops. Okay. Okay, so drug classes that affect the central nervous system, and you're going to notice on here and some other stuff too that sometimes the classes are called different things. Okay, you just need to have an idea of kind of, they may not be called the exact same name, but you'll hear they should be pretty similar. So, and then some, like this book breaks it down a little bit different than will online, but you'll get the idea. Okay, so sedatives, we know those are, sedate the CNS. Anti-anxiety, what's the other word for anti-anxiety, do you remember? Well, that is one type of classification that does this. I was looking for anxiolytic. Whenever you see the word anxiolytic, you remember that word? It has an X in it, doesn't have a G. It sounds like it. Anxiolytics are anti-anxiety. So anti-Parkinson drugs, antipsychotics, anesthetics, which are what?
Sleepy.
Yes, they make you not feel. Okay, anesthetics don't necessarily make you sleepy. Lidocaine would be an example of an anesthetic. You get an injection of lidocaine, like you get stitches or something. Hypnotics, anticonvulsants, or anti-seizure meds, antidepressants, and then, of course, narcotic analgesics. And analgesic means what? Pain, okay, not without pain. Analgesic, okay, without pain. Anesthetics without feeling.
So it's like morphine, a narcotic analgesic.
Yes, yes. Okay, so sedative, hypnotics, and anti-anxiety drugs. It says they're used to treat anxiety, or sedatives and hypnotic drugs are for anxiety and sleep disorders. Like I said, sedation, decreased anxiety, decreased motor activity, maybe kind of sluggish, mental acuity, same thing. So I don't want you driving if you're on these medicines. Hypnosis is defined by an increased tendency to sleep, then anxiety, irrational fear of a specific object, activity, or situation. Anticonvulsants, okay, so we know what a seizure is. Epilepsy is the name of a disease that causes frequent seizures. Probably heard that word before too. Sometimes you'll hear these, instead of saying anticonvulsants or anti-seizures, they might be called anti-epileptics. Convulsion, abnormal motor movements. Okay, Parkinson's. Parkinson's is one of the diseases we did in anatomy right now. For those of y'all. Parkinson's is characterized by resting tremor, so they just constantly move. Resistance to passive movement. Okay, what is passive movement? Remember we talked about passive range of motion?
Like is a healthy thought.
Yeah, somebody else does it, right? Like if I move your arm, that's passive movement for you. Okay, but there's resistance to that. Like their muscles don't want you to do that. Akinesia, which is an inability to move. Kinesia or kinese, okay, is movement. Like if you go to school to study kinesiology, it's the study of movement. Loss of postural reflexes, so they'll lose some of those reflexes like you guys did in class the other day in anatomy. And then behavioral manifestations. So there's specific things. Sometimes they might have, there may be some specific behavior things that they do. My grandmother actually has a type of Parkinson's, but it only affects her lower, it started at least in her lower body. And so her feet, even though her brain was telling them to move, they just would not move farther than half an inch. She just shuffle like this, and they just wouldn't move. But the second she would get to stairs, it was like something clicked, and she could go upstairs like it was nothing.
Mm-hmm.
Yeah. But then as soon as she got back to walking, it hurt. She literally, they would not move more than this. And it's, I don't know. They couldn't figure out what it was for a long time. They finally just, decided they called it some kind of dyskinesia, but I don't remember exactly the name of it. But it's a form of Parkinson's, I guess. Antidepressants, since depression is one of the most common psychiatric disorders in the U.S., lots of people on antidepressants. These are going to be some of the most commonly prescribed medicines too. Lots and lots and lots of people. Characterized by feelings of intense sadness, worthlessness, inability to experience pleasure in activities. We all heard the commercials. There's all kinds of commercials. Sudden weight gain or loss, helplessness, impaired functioning, so they get to a place where they really can't function or do their job. Or
there are more side effects than helps you.
A lot of them do. A lot of these medicines do. Loss of energy, changes in sleep habits. One thing to know about all antidepressant medicines is they all have a risk of suicide, which sounds crazy. You think it should make it better, but they can make it worse. So they always really, you just have to watch. So it can make them better, that's just I don't know.
That's crazy. You get on TV you hear about the drug, it does this one thing to death.
I know.
30 side effects.
I know.
How do you want to take it?
Okay, so these are all classes of antidepressants, and these are all things that you'll want to be familiar with. Okay, tricyclic antidepressant, you'll see that as TCAs. Sometimes on there online it'll say TCAs, it's an abbreviation for that. So examples of this is amitriptyline, Elavil, and nortriptyline. Okay, you can kind of hear the name in there, sounds similar. Second generation's cyclic antidepressants, Wellbutrin, that one's very commonly prescribed. Very commonly prescribed Wellbutrin. We'll do that a lot. MAO inhibitors, y'all probably seen that word before. MAOIs. I think I wrote a lot of medicines are contraindicated with MAOIs. So there's an example of that one. Selective serotonin reuptake inhibitors, SSRI. They kind of tell you how they work. Serotonin is a neurotransmitter. Okay, so once it moves out of the neuron, okay, remember there's other ones that pick up those neurotransmitters, so there's not all these free ones floating around. Well, this one inhibits the reuptake of all those extra ones so that they're kind of forced to get absorbed into that next neuron. Does that make sense? So that's where, when you hear these, you're like, oh, that means nothing to me. Well, that's what serotonin is, a neurotransmitter. Citalopram, also very commonly prescribed. Prozac, another one.
No.
So, okay, antipsychotics says psychosis is a mental disorder in which a person's capacity to recognize reality is distorted by hallucinations and delusions. Okay, hallucinations and delusions are not the same thing. Hallucinations means that you're seeing something or hearing something that's not really there. I know a man one time who used to see bugs. He would see bugs everywhere, crawling up the walls. That was a hallucination. And it was and he actually had really advanced Parkinson's, I think is what they ended up. And he had something else that went along with that. It was similar to Parkinson's, but it wasn't. So, but yeah, that's what he saw everywhere was bugs. But sometimes it could be that people hear voices. Okay, like somebody who's schizophrenic, hallucinations that's one of their biggest issues is that they hear voices and people telling them to do things, or seeing things. And they can't control it. It's not just delusions is thinking something that's not true. Like maybe, like if I think I am the king of England and I really act like I'm the king and I really believe that, that would be a delusion. Okay, does that make sense? You see the difference in those? And there's all kinds of different delusions that people can have, you know. They can be like grandeur delusions, like they think they're a king or they think that they're really, really rich or they think whatever. Okay, antipsychotics can be classified as conventional and atypical. So you'll see some that'll say atypical antipsychotic. They don't really fit into any category necessarily. Narcotic analgesics we've already talked about quite a bit. So those are the opioids, reduce pain, but they induce tolerance. Y'all know what the word tolerance means in that situation? Just means it's going to take more and more medicine for it to work. So they may start out taking, you know, a little bit, but after they've taken that over a period of time, they're going to need more and need more and need more to get the same effect.
Okay, so like when you take NyQuil and like and then it won't work.
Yeah, same idea. Okay, and that goes that way for, a lot of drugs. It's the same way for, you know, street drugs. I mean, people need more and more and more. Okay, drugs made from opium are referred to as opiates. Opioid is like opiate-like. Think of it that way. Okay, so we looked at these. Hydrocodone, hydromorphone is Dilaudid. Okay, and that's another one you guys need to make sure. You know, we saw that in the last one. Dilaudid and Demerol are the two that we saw. Meperidine. Okay, so make sure you know those two also. Methadone. I don't know what's in the next one. Propoxyphene. Okay, anesthetics. Since anesthesia is a unique condition of reversible unconsciousness. Okay, so you want to be able to bring them back out of it. Okay, or loss of sensation. Anesthesia, loss of feeling. Or action. So unconsciousness, analgesia, so it can work to provide pain relief too. Okay, makes them immobile. And then amnesia. They can have an amnesia effect too. They can make you forget.
Oh yeah.
Like Versed, I think is one example of that. General anesthetics, Valium, Diprovan, propofol, and then the next one. I know I've heard of Diprovan before. Okay. Good deal. Okay, let's go to that big thick packet. Find mine. Okay, now I have done my best to like mark the ones that I think are going to be most beneficial for you. And okay, let's skip on over to, oh, while I'm thinking about this, I can't remember if it's on here. I put on, I don't know, maybe like the second page, page 28. Have that page on there? Okay, it talks about books that are drug information sources. I starred some of the books on here that are, I've seen on these tests before. Okay, so make sure and look over those. Let me just tell you guys what pages I want you to read on here because we've really gone over everything already. I just want you to go on page 35 through 38 are the ones that you need. Those are the pages you need to read that go along with this. Okay? Okay. Okay, I'm going to go over these with you guys online real quick so that you guys will have this to look at. But in that big, thick packet that I sent you guys that has, it's out of another study book that I have. And anyways, I think it's got some really good information. And hopefully you guys can see where I starred some of the ones that I want you guys to know. So look at anxiety. I'm on page 35 in there. So anxiety is a state of uneasiness characterized by apprehension and worry, like we just said. So the indications for these medicines are to control anxiety, and then look, adverse reactions. So these typically can cause dependence. So people need them to function. Drug accumulation, birth defects if taken early during pregnancy, so you have to be really careful. People know when they're getting pregnant, or if they're wanting to get pregnant, they need to cycle off of it. Muscle relaxation, sedation, or depression. They can actually cause depression. Special considerations. It says many use are controlled, so keep that in mind. Okay, so I put a star by some anti-anxiety agents on here that we need to know. Some of these are in your med list, your weekly med list anyways, that you'll have to learn, but I just highlighted the ones that are on here that are pretty frequently prescribed at least. So Xanax, alprazolam or Xanax, buspirone. Okay, that one sounds a little bit different. That one's not a benzodiazepine like these that say LAM, PAM on them. Diazepam is Valium, lorazepam is Ativan. Okay. Depression, continue on 35. It says depression is characterized by feelings of pessimism, worry, intense sadness, like we said. So there's a few different types of depression medicine. We have SSRIs, like we talked about a while ago. They block the reuptake of serotonin. Adverse reactions, nervousness, insomnia, nausea, diarrhea, some might make them not sleep, decreased libido, sex drive, decreases sex drive. And so indications for major depressive disorder or OCD or anxiety. Those are all reasons that they might take these medicines or SSRIs. Look, delay of onset is 10 to 21 days. So people have to, it's not going to start working immediately. They have to be taking it for a while before it will work. All of these are going to be frequently prescribed. You're going to see pretty much all of these. I mean, I've seen patients with all of these before. Citalopram is Celexa, duloxetine, Cymbalta, escitalopram is Lexapro, very commonly prescribed. Fluoxetine, fluvoxamine, Prozac, Paxil, Zoloft, Effexor. All of these are going to be commonly prescribed, so those are all good ones to know, go over. TCAs, tricyclic antidepressants, block the reuptake of norepinephrine or serotonin. So indications, you want to take it for depression, but look, this one has another one. Could be used for nocturia or bedwetting in children. Interesting. Adverse reactions, so it's cardiotoxic in high doses. That means it's toxic to the heart. Postural hypertension, hypotension, in the elderly, so it can make their blood pressure go down pretty quickly. Drowsiness, and then anticholinergic effects. So when you see here the word cholinergic, think parasympathetic nervous system. It's like your normal breathing, slows your heart rate down, slows your breathing down. So if it's anticholinergic, okay. Noticeable results may not occur for several weeks again. So know that these are things. It's going to take some time for it to actually start working. Notice that the suffix tylene or amine, the only one I highlighted on here is Elavil, amitriptyline. Now, you need to have an idea that tryptamine, is a TCA, so you'll see these. Did I say TCA? Yeah. Okay, tetracyclic antidepressants. Depression is accompanied by anxiety, or both, have a high potential for seizures. It's important to know. Effects of medication may be delayed. So, again, okay, MAOIs, we'll see that a lot. Like I said, MAOIs, these monoamine oxidase inhibitors, have a lot of side effects, I said earlier. Have a lot of contraindications. Okay, so indications for atypical depression, they might cause hypertension. Lots of reactions again with other meds. Like if a physician changes their therapy, MAOI should be discontinued for 2 weeks before new therapy begins, because that's so many effects with other meds. Patients should avoid certain foods containing tyramine. That's something that you definitely need to know. That tyramine, you don't take MAOIs with tyramine. So eggs, cheese, certain wines, yeast products, okay? All those things, they're kind of like fermented, if you want to think of it that way. So tyramine, make sure that's important to know. MAOI should not be taken if the patient is taking ephedrine, amphetamine, methylphenidate, so any kind of stimulant, levodopa, or meperidine. Meperidine, remember, is Demerol. So examples, Nardil, like that was listed on here, is an example of that. Okay, bipolar disorder. This is a depressive psychosis alternating between excessive phases of mania and depression. Now, this doesn't mean that 1 second somebody's really happy and 1 second they're really sad. A lot of times people will go through longer phases of one or the other. They'll be depressed for a long period of time, and then they'll be manic. And when somebody is truly manic, you know, sometimes, I mean, it depends on the person, but they might be able to do no wrong, okay? Or they might go through a time period where they are, you know, they kind of live in this delusion that everything's good when maybe it's not so good, or they have this job and they really don't, or something, some examples of that. Okay, adverse reactions, bloody stools, acne, leukocytosis, hand tremor, increased body weight, polyuria, polydipsia, nocturia, lots of these. Abnormal development of the fetus during pregnancy. Special consideration says blood levels must be established for patients taking lithium. Okay, lithium is kind of like the standard for bipolar disorder. And they have to do blood checks on them very frequently to make sure that they can stay in that therapeutic range. And look, it's a very narrow range. Should be in the range of 0.6 to 0.8 milligrams per milliliter. Okay, that's a pretty narrow range there. Salt content must be monitored and alcohol must be avoided. No alcohol while they're taking this. Carbamazepine is another example. It says this interacts with benzodiazepines, which were a lot of those anti-anxiety medicines. Those are all the PAMs and LAM medicines. Cimetidine, corticosteroids, there's a ton of them. MAOIs, contraceptives, so many medicines that carbamazepine has interactions with. Tegretol is the name of that one. Devalproex, I'm not sure if I'm saying that correctly, but Depakote, that's a very frequently prescribed one for this. Lithium is, like I said, that's kind of like the standard. Valproic acid, Depakine, that kind of sounds like Depakote, same idea there. Psychosis, I'm on page 36 still. Psychosis is a chronic psychotic disorder manifested by a retreat from reality, delusions, hallucinations, ambivalence, withdrawal, and bizarre or regressive behavior. There's a whole lot of symptoms that fit into psychosis. But these medicines are used to reduce the symptoms with psychosis. They're helped to reduce hallucinations, reduce delusions, and reduce the thought disorders. Okay, adverse reactions, lots of these. Sedation, anticholinergic responses, postural hypotension, excessive tanning, hyperglycemia, so they may have high blood sugar, lack of menses, that means women may lose their period. Non-reversible bone marrow depression, that means it doesn't go away. Now think about it, if your bone marrow is depressed, okay, then you're not going to make white blood cells like you need to. Okay, you're not going to make blood cells like you need to. Dystonia, akathisia, and pseudoparkinsonism. These are three that are pretty well, you always specifically hear in antipsychotic medicines. These can really be debilitating for someone, and a lot of them are non-reversible. Okay, you look those up. I want you guys to look those up. You'll hear the word tardive dyskinesia. I want you guys to look that up, and it goes along with this psychosis. So research that a little bit. You guys see what you come up with on your own. Following drugs may minimize the side effects. Dimenhydrinate, benzotropine, whatever. So those can make it not work like it needs to. Gains in reducing symptoms may take anywhere from 6 to 12 weeks. So long time to make it start working. Discontinuing medication may lead to a relapse of the symptoms. Okay, there's a ceiling dose of thiordazine. A lot of them, they have to check blood levels of these also. Haldol is one example that's very frequently prescribed. Zyprexa, Compazine, Seroquel, Risperdal, all of these are antipsychotics that you'll hear the names of. So, okay, insomnia. Insomnia is difficult in falling and remaining asleep. Okay, so people have trouble going to sleep. We've already learned about some of these because they were on your med list that first week. So adverse reactions are CNS, depression, dizziness, impaired reflexes. Do you think deep sleep? These are the reactions. It makes sense. Xanax, again, so it's an anti-anxiety and it belongs on here. Same thing with Valium. Same thing with lorazepam, which is Ativan. So all of those you've seen before on the anti-anxiety list. Well, they're also on here. Some other ones on here, Lunesta, Restoril, think rest, sleep. Okay, that's tenazepam. And then Zolpidem, Ambien. I always think of Zolpidem Z's, sleep. Okay, at the top of the right-hand, top of page 37, drugs for the treatment of central nervous system disorders. It says epilepsy is a neurologic disorder defined as paroxysmal recurring seizures. It involves disturbances of neuronal electrical activity. So something's going on between the neurons in the brain that this is causing this electrical disturbance, causing the seizures. Okay, seizures can be partial, generalized, or status epilepticus. Ooh, can't talk today. These work by blocking the firing of neurotransmitters, so they block the firing of those so that those neurotransmitters can't send the message on to the muscles beyond that in order to make them spasm, kind of like they do. Adverse reaction, sedation, and loss of cognitive processes for a little while. So sedation, a lot of times after people have had a seizure, they kind of go into this like sleepy mode anyways. Monotherapy is preferred over polytherapy. That just means one medicine is preferred over many, so they want to find the one medicine that works for them, unless that's just not working either. So a large number of drug interactions may occur with anticonvulsants because of induction or inhibition, because of the effect that they have on the neurotransmitters. Okay, and some of these you've seen, we saw before with what page here? You saw these on the bipolar ones too. Tegretol. Sometimes you'll see Depakote on here. Yeah, there it is. So Tegretol, clonazepam or Klonopin. That one's pretty frequently prescribed. Valium, we've seen that one before. Depakote, Neurontin, this is a different one. Gabapentin or Neurontin. Okay, that's a new one, and you'll see that one. Okay, think Neurontin. Sometimes people also can take that for like nerve disease in their legs, neuropathy. Lamictal, Trileptal, Luminol, Topamax is another one that you'll see a lot. Topramate, valproic acid, Depakine. Okay, Parkinson's disease. It's a group of disorders resulting from pathologic alterations in the basal ganglia. Okay, so it's like we just talked about Parkinson's. It causes the tremors, that dyskinesia, abnormal movements. But it has, it affects the brain too. It doesn't just affect. Adverse reactions, nausea, vomiting, cardiac arrhythmia, so the heart gets out of rhythm, drowsiness, postural hypotension, insomnia, constipation, diarrhea, all kinds of stuff. Can't make up its mind. Okay, special considerations. Therapy is aimed at symptomatic relief. There's no cure for Parkinson's. They just try to minimize the symptoms as best they can. Lots and lots of side effects. And then, of course, no alcohol. So examples of these that I highlighted on here, levodopa, carbidopa, Sinemet. Okay, levodopa, carbidopa, that one's kind of their hallmark one there. And then Requip is another one that I've seen a lot of, that ropinirole, Requip. Okay, ADHD is characterized by hyperactivity, impulsivity, and distractibility. Now, these medicines can have a different, like the opposite effect of kids and adults. So make sure when you think, okay, why would you take, it's a stimulant, it's a CNS stimulant, so why would somebody take a stimulant to help them for ADHD? Well, and it can have the opposite effect on people, kids versus adults. Patients taking methylphenidate, that is the Concerta Should have complete blood counts performed periodically. So blood work is involved. They want to make sure that they don't get to a toxic level. No caffeine. Okay, amphetamine, dextroamphetamine is Adderall. You guys have probably all heard of Adderall before. Okay, Vyvanse is another one that was on our weekly medicine list, and so is Concerta. Ritalin and Concerta, same drug. Okay, multiple sclerosis, autoimmune disease, the myelin sheath around the neurons it just deteriorates, and so nerve impulses can't travel very good down the length of the axon of the neuron. Hopefully you guys are in anatomy. This results in loss of muscle, and it can reduce it in eyesight too. So adverse reaction of these is they make you photosensitive, so that means that you would burn easily whenever you go outside. Products require special storage. Some of them are given daily, some of them are weekly. Avonex is one that I've given before, once a week, shot-wise. Alzheimer's disease is a degenerative disease, says of the brain that leads to dementia, but it's more than just dementia. I mean, this actually makes the brain deteriorate. So you guys should Google, MRIs of somebody with Alzheimer's, and if you put them up side by side with the normal MRI, you'll see it. Hey, it really does make a big difference. I mean, you'll see what happens. Nausea, vomiting, diarrhea, it can't be helped. These are really just to help the symptoms. So the ones that you'll see most commonly are Aricept, I would say, and Namenda. Exelon is a newer one, and I've seen that some too, and probably all of them, but Namenda is one I've heard the most about, and Aricept. Okay, so those are your CNS drugs. I know this little packet right here is pretty thick, but I just wanted to give you guys something else that you can use to look up some of these meds, and this actually lists medications on it, which I like. I want you guys to see them and hear them, and sometimes online they don't actually list the medications that I think that it expects you to know. So anyways, that's that. I hope you guys make sure you study. You guys need to go ahead and get done with the stuff on the CNS part online so that while it's fresh. And I told my students here too, I think something that would really help you is just every week, maybe on Fridays, go through and take the old quizzes. So like if you take the CNS quiz tomorrow, next week, go back and take the CNS quiz again. Just keep on taking them. You can take them as many times as you want to study for the test. Because whenever you get to this med test at the end of this unit, it is going to be hard. Okay? I'm just telling you, it's going to be hard. So make sure you're prepped and ready for that. And that's it.